Welcome to At the Nurses Station with Kelly and Sam, a podcast for nurses about everything except the patients. We're here for us. It's like a dreary, foggy, kind of nasty day outside, but I'm excited to be talking to you. And we have an awesome guest today.
We do. And it's horrible outside. I went for a walk with a friend and was, I think, walking through a cloud. I don't know. I'd like to know how you are doing because I think that's the polite way to open a podcast. So Kelly, how are you?
Oh, I'm sorry. Was I supposed to say that to you first?
Well,
I'm good. I was telling you before we started, I have a Christmas party tomorrow at my house. Yeah. So I have like Costco and finish up decorating and cleaning the house and making sure my kids are, in order all before tomorrow at 2 a.m. That would be a weird party time.
That's the kind of party I could get to right there.
Right?
Yeah. Mm-hmm.
Yeah. No, so I'm good. I just got a lot of Christmas stuff going on today.
I don't know how I feel about going to Costco today. Like between now and like January 15th, that seems like you really need to go if that's what you're doing. And you can't get Dad to go for you?
No, he doesn't do that. He does that for his mom, but no.
Oh, okay.
I'm just going to take a hydroxyzine before I go. It'll be fine.
And be sleepy?
Well, no, it doesn't really make me sleepy. It's just going to take the edge off.
Or not itchy. Okay. Well, I would offer to be more helpful to you, but I kind of don't want to go to Costco and also have other things to do. I do need to tell you, though, that 3 kittens. Have we talked about the kittens yet? You know that I've procured them. Yes.
Yes. And I've seen the black one.
This may have been a mistake, Kelly.
It seems like something I would have done. I'm actually shocked.
I really should have thought this through harder. They're lovely. And when they're asleep, they're adorable. But at like 10 o'clock at night and like 6 o'clock in the morning, they're unbearable. And so I was just thinking that I needed to tell you that publicly, that I feel like I don't make mistakes often, but this may have been a mistake. So,
and you can't take it back.
I can't?
No, you gave your children kittens. You cannot be that mean.
That's probably true. I can't. And I really love them actually, but there's no ornaments on my Christmas tree. There's a basket of ornaments underneath my Christmas tree. My laundry room is not lovely like I like it to be. It smells lightly of cat and I have to clean the litter box every single day. And I just, so all the erasers are gone on all the pencils for school that the boys use. They're just gone. What had Ian said today? Mom, did somebody put the eraser in the pencil sharpener upside down? No, they did not. Your dumb freaking cat ate it. But anyway, okay.
Are they all getting along though? Because they weren't from the same litter.
Yeah, they do. 2 of them like sleep. I hand knitted a little cat bed yesterday with like a pinky yarn. Yeah, it's jank, and it is definitely not in a perfect circle. But I did it. So 2 of them will sleep together, and then the orange one is kind of the odd man out, but they're not hissing at each other anymore, and they're kind of like chasing each other very loudly around the house. And
it's called the Zoomies.
The Zoomies, yeah. They have it. And they can't go outside because it's horrible. And yeah, I don't know. It'll be okay. It'll be fine. It'll be fine.
You just have to let go of a little bit of control. Is that all?
Or go to work more often so that I'm not here during those hours of the Zoomies and just let Philip. They love Philip. They sleep like on his head and in his lap and next to him. So maybe I'll just let him deal with it.
Well, I do have some great litter tips for you. So I will let you know how to keep your litter from smelling horrible.
I'm concerned about this. It can't be that hard, but okay. Anyway, so back to what we're doing today. We have a lovely guest and we're really excited to introduce him to all of you lovely listeners at the Nurses Station. His name is David Rosenbeck. He's one of our own. He's a nurse practitioner with a background in the ICU and in the ER. So we love that. That's kind of all of our, what do you like? Keep your friends close and your enemies closer. That's why we love you, ICU. and is now a nurse practitioner living a very fun and maybe dreamy lifestyle, it sounds like. So we're going to get into a little bit of his professional background, some of the stuff that he's working on now to help us as shift workers be more sane and maybe have other options in our life after we go through nursing school and realize what it's really like to work at the bedside. And then, of course, we'll drag him into our pulse check and see what he has to say about that. But David, we're really excited to welcome you onto the podcast. So thanks so much for being with us.
My gosh, thank you guys so much for having me. This is going to be fun. I'm excited. It's been what, three and a half years since I've been in a nurse's station. So I'm excited to be back in.
Oh, this is the best nurse's station right here. Can really be in your jammies. Okay. So yeah, we're happy to have you. And I kind of just want to start at the beginning. Nursing is like, we all know the process of being a nurse, and we know like some people do it for love, some people do it for money. Either way, whatever is great. How did you make the decision to jump to being a nurse practitioner? Because I think that's something that a lot of us think about a lot.
Yeah. So, I mean, nursing in general, like I don't know if it's bad to say or not, but it wasn't like a passion of mine. Like I have to be a nurse whenever I was going through high school. And really it was my dad kind of nudged me in that direction because older cousin of mine, he had been working as a nurse for a couple of years whenever I was a senior in high school. And he was like, what are you going to do? Like, what are you going to go to school for? And I was like, heck, I don't really know. And he's like, have you ever thought about nursing? Like your your cousin, Justin, he does it. And I was like, I've never really thought about it. And I had two sister-in-laws that were both nurses. And so I, did a little bit of shadowing, and I was like, well, I mean, it's a solid career. It pays well. You get a little bit of flexibility with it. And so I was just like, yeah, makes sense. And I just decided to go down that path. And once I got my bachelor's, I started working in the CV ICU. And then two of the guys that I had lived with during college, they were both going through the same, nursing school that I went through. And then both of them decided they were going to go straight back into NP school. And I was like, I don't really want to, but I was like, if both of them are doing it, then I might as well do it as well. So I worked ICU for a year, and then started working in the ED following that. And I did that for the last 2 years. I did a part-time program. It took me 3 years to get my family NP. And then after I got through NP school, started working for an interventional GI group that like focused mainly on oncology. And so like upper malignancies, pancreatic cancer, esophageal cancer, liver, stomach, et cetera. We would be the ones doing the scopes. We would do like ERCPs, endoscopic ultrasounds, all of that stuff. And it was cool because I got a chance to be in the hospital doing consults, rounding in the hospital, seeing our patients, but then also I would follow up and see them in the clinic and outpatient setting. So I got a little bit of everything out of it.
I have to jump back there for just a second. Which is better, ER or ICU?
I knew.
Oh, ER, hands down. Not even a question. I loved the ER. I'm much too much of a type B person to thrive in the ICU. And the thought then of having to have the same like patient 3 days in a row was just brutal to me. And so then once I went to the ER and I was like, oh, there's only 3 options. Either you admit them, you discharge them, or you transfer them somewhere else. Like basically the fastest I can get to any of those 3 options. That's all I have to do. Yeah, fantastic. Let's do that. And
yeah, I don't have to remember their name, anything.
Yep. I love
3 days. At 3 hours, I'm like, okay, where's my disposition? What are we doing with this human? So your oncology story is honestly really interesting to me personally. Many of our listeners know I walked with my mom through pancreatic cancer a few years ago. And one of the things that they didn't give us as much information as I think was reasonable up at the jump, but she was transferred to a specialty hospital for that. Like special, I'm familiar with the ERCPs and the MRCPs. I've done those at bedside, but they did like the special ultrasound biopsy that sounded like an ERCP in nature, but was something completely different.
Yeah, endoscopic ultrasound. That was kind of like our bread and butter of what we did mostly. And so basically it's like a regular scope. They're under conscious sedation. But once you get the scope inside there, it's got a little ultrasound probe on it. You press the ultrasound scope probe up against the wall of the stomach, and the pancreas is sitting right there. So you can do direct fine needle biopsies through the stomach tissue into the mass because you're guided by ultrasound. Take biopsies, do whatever you need to do in there. We could do liver biopsies. I think we even did some adrenal biopsies, and you're just punching a tiny little hole through the stomach to get to where you need to go. And then you pull the needle back, and then, the stomach tissue closes right around it.
That's not at all what I thought it was.
That sounds fun though.
Yeah, it was a cool job.
Every time I've thought about like going to NP school, I'm like, sometimes I feel like being a nurse practitioner is more boring than being a nurse because you don't do as much. It's more of, the charting and the seeing lower level patients, but I could totally do that.
Yeah. Yeah. It was like the idea of being in like a family practice clinic that like made me want to jump off a building. I didn't want to have to do that at all. Whenever I was doing clinicals with it and you're just seeing like your 10th hypertensive patient for the day and like, or working on diabetes medications or something like that. Is like, if I'm doing this, I got to be doing something a little bit more exciting, especially, with my background of, ER, ICU. I was like, I got to be doing something like getting my hands into doing something fun. So family practice was never going to be an option for me. Basically any just like straight clinic job was not going to be an option.
I'm curious. So the ER was really your jam because of the high turnover, and I don't want to put words in your mouth, but I like it because I don't have to make like a connection with all of my patients all of the time for my person. Shut up, Kelly. Don't laugh at me. I find that very draining on my personality. Like it's a lot to ask for from someone. Yeah. But if you're working oncology, like that's really like those are heavy patients that you keep for a long time. So how did you find that experience, knowing that those patients were going to most likely continue on your service for 18 months to maybe a handful of years?
Yeah, well, I mean, that was kind of the harder part was that nobody stuck around very long, because we dealt with a lot of really rough malignancies, pancreatic, esophageal. HCC was actually my specialty, hepatocellular carcinoma, so cancer of the liver. And so that was kind of a lot of the patients that I would see. And I mean, we had usually about 5 people in our group, 6 people in our group. So like every 5 to 6 weeks, then we'd be a 7-on inpatient rounding. And then, on your off days, then you would be, those off weeks, then you would be in the clinic. And if I was doing like the actual follow-up for like chemotherapy and all of that stuff, that would be much different. If I was like in heme onc versus just like GI onc, we were mostly almost kind of like plumbers. We were just making sure, bile ducts were draining appropriately. The pancreatic duct is open. We could put stents inside the pancreatic duct, put stents inside the biliary tract, all this other stuff. So we just kind of made sure that things were moving in the appropriate direction. And it was more like technical things than medical things, if you will. Like I wasn't like managing their medications. I wasn't telling them what chemotherapy they were going to be on. I wasn't doing any of that stuff. Gotcha. And I think that would be very, very taxing because, I mean, you're seeing some of those people like, weekly rounds of chemotherapy. So you're seeing them once a week. And so I think my patients, like my HCCers, whenever they would get kind of like towards the end, I would see them every like 2 weeks, I think was my normal rotation then, maybe. But most of them were like once a month or every other month. And basically they would come in, we would do liver enzymes, we do a total bili. We would actually, most of the time we'd get an MRI like every 3 to 6 months, depending on what was going on with them. And basically we would just monitor their HCC and see if it was growing and if we needed to send them to IR to do, any sort of treatments or something like that. But that was pretty much the most follow-up I had was usually about once a month with people. So I wasn't, really, really in with them like what some of the oncology people are.
Like in the thick of getting to know their family members and all of what nausea medication works for them or doesn't work for them or whatever.
Exactly. Yeah.
That just seems like, I'm glad that people can do it, but I'm like very thankful for them, but it seems like just so much to do.
Yeah. The med-onc pod where we like had our clinic, we were in the big cancer institute and their pod was right next to us. And I'd go walk over there sometimes and ask them questions. And I'm like, bless you people, because this is a lot.
It's so much. It's an unfortunate situation. Though when you find yourself there for sure. So, I mean, I agree with you. Anytime I talk to like younger people or high school age, I'm like, they're like, oh, maybe I want to be a doctor. I don't know. I'm like, just be a nurse. Be a nurse because you can work bedside. You can essentially be a provider, become like a quasi surgeon. You can do stuff in technology. You can be an educator. I don't know. Are there construction nurses yet? I feel like if you asked me to build a house, I could probably figure it out. I don't know. It can't be that hard. But what was it that drove that? I don't want to say drove you away, but started making you think about moving away from doing that more traditional patient care stuff?
Yeah, so it was kind of a twofer for me. For one, I heard one of my colleagues, she was a palliative NP that I actually went to school with as well, and me and her were good friends. And I hadn't seen her for like 3 months in the office, and I was like, "Where's Kara at?" And they're like, "Oh, she's working remotely now." And I'm like, "Excuse me, what are you talking about? I've never heard of anybody working remotely as a nurse. What do you mean?" And so I called her up after work that day, and she said, "Yeah, I'm working as like basically a oncology navigator as a provider." So basically somebody goes in, gets a diagnosis, and then they leave the clinic and they've got a million questions because they didn't know what to ask while they were in there. Then she was working with them to where they could call her, ask her questions, and she's a little bit more, she's allowed to say more, if you will, as to just like a nurse navigator, because they are restricted by their license versus, you know, you're calling a nurse practitioner. They can just, you know, give you a little bit more in depth without worrying about like licensing and stuff like that. And so she was really like somebody that would get on phone with people and like explain to them what was going on. If they had any additional questions, she could help them through that. Hey, you should ask your main oncologist for X, Y, and Z. I think this may be able to help you out. And so she really enjoyed her job. And so whenever I found out that remote work was even a thing, then I was very intrigued by it. And then not too long after that, that was kind of like it seems like everybody's got that one patient story that's like, it really, really hit them hard, you know? And mine, it was a guy, he was like, I think he was 54 years old. I remember walking to E24. It was an ER consult. I was working in the hospital and it was like 3:30 in the afternoon. New consult came through, you know, like a 4-centimeter pancreatic mass, multiple mets to liver, XYZ. And I'm like, you know, okay, you know, this is probably, I think it was on a Friday. So I'd probably seen, you know, 8 other people, same situation that week. And I was like, okay, I'll go down, you know, bang this consult out quick before I head home for the day. And I remember walking up to the door. There was a crack in the, you know, the curtain as I was walking up to the door. And I just peeked inside there. I was like, what's going on with him? I had my rounding nurse Hope with me. And he was, you know, very jaundiced, typical for pancreatic cancer patients if they're pushing on that bile duct. But he was like in there just laughing and, you know, chopping it up with his wife. Seemed like he was just, you know, having an okay time in there. And I just remember thinking, I never really thought this before. It was like, I'm going to walk in there and I'm just going to ruin their life, you know, like whenever I start talking to them about this. And so went in there, started talking to them, kind of went through my whole spiel about, you know, what was going on. You've got a large mass, you've got mets to your liver, like basically like looking at 6 months is probably like best case scenario here. But obviously you'll talk to your actual medical oncologist. They'll help walk you through what treatment options are. I'm just here to tell you, like, this is what we're finding and this is what our next steps are going to be. And he was talking to me about his business, and he was like, man, he was just, I could tell he was like, not the normal kind of like shocked. It was like he was disappointed. And we just got talking. And that was something that I was like really good at, was just like chopping it up with people and just like, you know, trying to make it, you know, as light as can be. And I'm good at explaining things. I came from a very blue collar family. A lot of these people, whenever they get into medicine, they're like, their people skills suck. So they're not really good at talking with people. And I felt like I could really explain things very well to people and like, you know, bring it down to somebody else's level that has no experience with, you know, medical at all. And, he told me, he was like, I've been working my ass off for decades to build my business up, to then we just started the process of handing the business over to our kids. And me and my wife, we were about to take off. We were about to get into the golden years, like retirement. We've got more money than we know what to do with. Everything is going to be fantastic because we sacrificed and we pushed off for so long. And then now it's finally time for the good years. And then good years just got chopped. And like the last thing he asked as I was getting ready to walk out, he was like, hey, my wife and I, we had a motorcycle trip planned for next week. We were going to go down to Florida and we were going to be gone for 2 weeks. He's like, do you think I should go? And I said, yes, absolutely. 100% you should go. I said, medically, probably not. You should probably start your treatment as quickly as possible. But I said, hell with that. Go on the trip. And they went on the trip. They went down there. He showed me some pictures. I followed up with him in the clinic afterwards. Just the nicest guy ever. But he ended up, it was almost right at 6 months. He ended up passing away. And just like after all of that, I was like, man, and really like the big part too is my father. He was just about ready to retire. And I was thinking about that too. I was like, man, what a brutal, unfair thing in life to like, you know, work for so long, get through so many things. You met all these milestones and finally it's time, you know, you pushed off gratification for so long. And then you decide to, you know, then something like this happens and you're just like, son of a gun. And so that kind of like pushed me into, I don't want to push anything off. I want to be doing what I want to be doing right now. My wife and I, we love to travel. It's our favorite thing to do. And I was like, how could I start traveling sooner? And so I actually initially started looking into doing like locums work. But then I was like, I don't know, then you're still tied to a certain location. And then once I started really digging into the options of working remotely, I was like, that's perfect, because I can, wherever my laptop is where my workspace is. And so I just went full bore into that. And then luckily it worked out. And we've been able to hit, I think, 37 states in 7 countries in the last 3 years. Wow. And it's been incredible.
Now, tell me how that works working internationally, because Sam and I have very different political views, but in this political climate, I have been multiple times. I'm like, I'm going to Mexico. I'm getting out of here. So if you can teach me how I can work out of Mexico, that'd be great.
Yeah. So the only thing is I never I never actually worked whenever I was international, like whenever we traveled to different countries. But the crazy thing is I get 7 weeks of vacation for my remote job, and I actually get to use my PTO instead of working as a nurse. And, you got to try and like work 6 in a row to have like an 8-day gap. And then you maybe take some PTO, but then you're putting your other coworkers out because you actually took some time off and you feel bad about it. With this, it's like, oh, I could just say, I don't want to work Monday, send an email to my boss, and I'm just good to go. Like that was just such a mind-blowing thing for me. I was like, oh, this is what normal work is like for people.
Mm-hmm. I don't know that normal work is like that, but it sounds like you like definitely found a good place to be. And so what was your first not bedside job?
Yeah, so I originally started working for an insurance company at first it's called utilization management is the term. And it was hilarious whenever I was doing my interview. So, I mean, it took me multiple weeks, if not maybe months, of like searching around, trying to find a job that would actually like fit into something that I actually wanted. Because I wanted something that was not patient forward at all, not having a scheduled call. I wanted to work off like more productivity as to having like a scheduled day. So I knew that my options were kind of in that from my researching around. And finally, after, I don't know, hundreds of emails, hundreds of hours of searching around, trying to find something, I mean, it was brutal. Found this job, got an interview for it. And then I'm like, I'm sitting there, I got my suit on from the waist up and, basketball shorts on from the waist down. And I'm sitting there ready for my interview. And then it just pops up and it says it's a video interview. I'm like, okay, well, I assumed it was a video interview, but then it's like, no, the question pops up and you're supposed to record your answer and you send it to them. And that's kind of like a first step process. And I was like, oh crap. So then the question pops up on the screen asking something about utilization management, which I know absolutely nothing about. And so I saw that it gave me 3 tries to record my answer, and I got 5 minutes in between each one of them. So I would sit there, I would read the question, be sitting there Googling the answers for it, and then I would record my answer, acting like I knew what I was talking about. And lo and behold, I ended up getting the job. And it's just like with anything else, like nobody knows how to be an ER nurse. Whenever you graduate nursing school, you learn everything on the job. And so I knew like I'll for sure be able to learn whatever's going on the job once I actually get in there. But sometimes you just got to fake it till you make it a little bit.
That is, my husband calls it nursing hubris, but that's what I learned in nursing school, was that I don't actually know anything about anything, but if you put me there, I can probably figure it out. And then
100%.
I mean, this started with grass growing because I tried to grow grass in our backyard, and he's like, well, that's not how you do it. I'm like, it can't be that hard. It's just grass.
It grows everywhere. It's got to be able to work back here, right?
Right. It's got to be easy. So
I feel like it takes a little bit of courage starting any new nursing job, because you do have to just jump in there and be like, all right, I don't know what I'm doing, but I'm going to figure it out.
Yeah. Yeah. And luckily they were pretty patient with me, because then once I actually got into it, I was like, yeah, like this is, because at least I think my one leg up that I had was that I would do peer reviews for like things that I would order. And so if I ordered an MRI and insurance pushed back on it, they would call me and I would have to do a peer review and like explain why I need this MRI. It's like, hey, there's a mass on this person's pancreas. We need an MRI to see what we can do with it, So I think that was kind of my saving grace a little bit with it, because I was able to be like, I've done, like kind of this stuff before. But then once I got into it, I mean, it took me a month and I was already, like kicking and getting into it. And really like the main the main crux of the entire situation with utilization management is like, there's usually a gripe between the hospital and the insurance company, like as there always is. And whenever I was interviewing, actually, I was like, am I the good guy that approves everything, or am I the bad guy that says no to everything? And they said, no, you're the good guy. You try to get everything approved. And I was like, oh, that's beautiful. I can do that job. No problem. And so basically go in, and I was the only nurse practitioner on the team. I just wanted a remote job. Everybody else I was working with was just had a nursing background.
Just nurses,
yeah. And so I, once I got into it, basically all you do is review the chart. You write an appeal letter medically justifying why XYZ was done in the hospital. For the most part, it was a lot of just like inpatient versus observation, because the payment or the reimbursement's different. And so patient's only there for 2 days. Insurance says it should be observation. And then I go in, medically justify everything that was done and why they were sick enough to be inpatient status. And as long as I got 5 of those done a day, I was meeting my productivity threshold, and they were happy. I was happy. And I got to the point where I was done in like 2.5 hours, and I'd have the rest of the day to just do whatever I wanted to do.
And I don't want to push back on you, but I am curious, how's the pay for these remote jobs compared to working in the hospital?
Yeah. So I took like a little bit of a haircut. It was like a 20% reduction from my NP salary. And I was in the highest paid specialty in my hospital. And so I was making really, really good money at the bedside, but I had started getting into real estate investing. And actually during COVID, with how many traveling nurses were going around, started getting into what they call midterm rentals. And so basically like furnish finder properties where people stay for, 3 to 6 months at a time. I started getting into that. And so we had then some passive residual income coming in. And that was another reason that I felt comfortable enough to step away from the bedside and, take that little bit of a pay cut, because now it's being supplemented by that. And I was like, and I'm making money without being anywhere doing that. I want to do more of that. So if I can get into a job that gives me more flexibility, more freedom to then pursue that even further, then that just continues to snowball. But to answer your question, it was 6 figures still.
Yeah. Okay.
Now, what does your wife do for work? Does she work alongside you, or she just travel with you?
So she carried my bum rear through grad school. And so now she's a photographer and an interior designer. She worked at a factory whenever we were going through grad school, or whenever I was going through grad school. And then once she got through that, and then we decided that I wanted to start working remotely, I was like, you can just quit your job. Like, we're good. We can just start traveling. She's like, all right, sounds good. So yeah, photography and interior design is what she focuses on now.
Amazing.
Kelly, do you know how much interior designers make? We were actually just talking about this at work this weekend. Just for the design of your kitchen is like $35,000.
If you get into some of the crazy people, it's wild how much people will charge.
What? I mean, not that I'm saying that they're not worth it. I just like, who has that? Like, I can't even afford to, the kitchen remodel itself is probably, I don't know, close to 100,000 then to pay more tens of thousands, because you have to figure out what it looks like. I was amazed. It's a very cool job as well. So I don't know if Kelly, would you?
No, you told me once that I would never be a fashion designer, so you wouldn't like my interior design as well. So nobody would pay me for that.
Probably not. I feel like that's like a house fashion design. Someone could pay me $35,000, but I'm just going to tell you to make everything white, which is what I've done in my own house, because I'm not good at making decisions. So I probably need to save up for someone like that to help me with those. Okay, so you've been not in the hospital setting for how long? Did you say
since May of 2022?
May of 2022.
Yep.
You would know what day it is today. Okay, 25. So like 3 years.
3.5 years basically been remote now. Yeah, I've spent now. I think I've gotten over the hump. I've spent more time working remotely as an NP than I have working at the bedside as an NP.
Okay. Does your family, so you have 2 sister-in-laws that are nurses and a cousin. Are you still the go-to in the family text message group for literally anytime someone has a fever?
Well, I'm the only provider in the family. So I still get all the questions, but I'm like, you guys, like, my one brother has 6 kids. The other brother has 5 kids. And then my sister has 3. And then her brother has 5. Her sister has 3. So they all have a bunch of kids and I have none. And they'll still ask me kid questions. And I'm like, you guys know more about kids than I do. I was working oncology. I don't know anything about kids.
Like they'll probably live Tylenol. I don't know.
Exactly. I'm like, I'm sure it'll be fine.
I just love when you get the text message with a picture that you were not expecting.
Yeah.
Of like someone's butt with a cyst on it. And it's like, what is this? And I'm like, your ass? Like, why are you sending it to me?
You know what that looks like? That looks like something that needs to be seen by somebody else other than me. Yeah.
Yeah. Squeeze it really hard. Find out. It'll be fine. That's my kids won't bring anything to me. They're like, don't touch it, Mom. I'm like, no, I just need to. I bet it'll come out. Just come here.
You're a Dr. Pimple Popper, huh?
Uh-huh. Yeah.
My 14-year-old has started getting blackheads on his nose. And I'm just like, come here. Let me get them all. But he won't let me touch him anymore either. So,
well, then it has to be taken care of. They'll never get a girlfriend. So that's kind of how that goes. So you sort of touched a little bit on how it was difficult to find a remote job. And that is kind of the space that you're in now, is helping nurses and other medical specialties. Yes, not just nursing.
As of right now, only nursing. So we're focusing on NPs, psych NPs, and nurses. Yeah, but we're thinking about getting into the other 3 Ps at some point. Physicians, PAs, and pharmacists would be the goal here in somewhat of the near future. But
I didn't even know there was a term for that. Okay, cool.
I mean, we made it up. I don't know. That's just what the 3 Ps. Yeah. So yeah, I then, as you can imagine, like our first place that we went to once we started traveling, we headed to Denver. We were there for a month. We were in Depot Bay, Oregon for a month. And then we were in Southern California, Arizona, Texas, Florida. I mean, all over the place, just traveling around. And so then all my old coworkers, people I went to nursing school with, they're all like, what are you doing? How are you traveling? Like, what is going on? I was like, oh yeah, I work remotely now. And then the same reaction that everybody has that's a nurse. They're like, what do you mean you're working remotely as a nurse? Like that, I've never heard of that before. And so after, like the 10th person, I was like, I need to come up with a way to like make this easier on me and on them, instead of just telling them like, keep applying forever. And, you have to wade through all of this junk to hopefully find some gold. And so I got a hold of my buddy, Alberto. He's been an entrepreneur his entire life. He did a lot of online businesses and stuff. And so I called him up one day. I was like, hey, this is the situation. This is the problem, is that there's a ton of burnout in the nursing community. There's a lot of people that are thinking about leaving nursing. And instead of using the degree that they worked so hard for, they're just like leaving the nursing profession altogether and not even using their degree anymore. And I was like, there's this whole other section of nursing that I knew nothing about. I was pretty, involved in the entire nursing space and never heard anybody talk about remote jobs. And now that I'm on the other side of it, there's remote jobs all over the place. People just don't really know about them or know how to find them. And so I said, is there any way that we can like filter this down and clear up the noise just to make it easier for nurses trying to find remote work? And so that's where Go Beyond the Bedside came in. And so we came up with this idea. We came up with a proprietary filtration system for it. And basically it takes, on average, if you go on LinkedIn, Glassdoor, Indeed, etc., and you even click the remote only job box and type in nurse, it'll still be, on average, every 24 hours, about 1,500 jobs that'll come through per day. That's like 25 pages of jobs that you have to sort through. And most of them are travel nursing jobs that some, recruiters trying to be sneaky and say, this is, remote because you're not at a hospital, or it's some repeated, expired job listing that keeps auto-populating that's filled, or just, a lot of bogus that you got to go through. And by the time people hit, page 3, they're done. They're like, I don't have time for all of this. And they just kind of get, disheartened, and they decide that they don't want to try and pursue it anymore. So now we take those 1,500 jobs, and on average, it filters down to about 50 to 60 jobs, usually on average. So instead of 1,500 jobs to go through, that would take you 3 hours, it's 50-ish jobs. And a lot of those, they're RN jobs, psych NP jobs, and NP jobs. So then if you just have the RN filter on, you might get 25, 30 RN jobs. You can look through 25 job listings in, 10 minutes. So we're just trying to cut down on the amount of time that it takes for people that really want to find a remote nursing job, cut down that time frame, and just make their life a lot easier.
That's amazing. I have actually done that. I think a lot of nurses, when you are on your 4th 12-hour shift in a row, you're like, why am I doing this? And you'll just start searching for jobs. Like, it just makes me feel better about my life knowing that I can leave anytime I want. But I have done that exact thing where I've typed in remote RN, and it's like, none of this is remote. This is stupid. And I just close it.
100%. Exactly. Yeah. People like instantly, they're just like, oh, this is bogus. This isn't real. And we've been met with tons and tons of speculation, not speculation. What's the word I'm looking for there? Tons of resistance. I don't know. I don't know the word I'm looking for, but like we went to like Nurse Blake. He had a nurse camp that he did just a few months back. And so we went to this, like, it was like a camp retreat. And I think there was like 400 nurses there. So me and Alberto, we went out there and we hung out for the weekend with all these nurses, and every single person we talked to, like, you could tell they were all just like trying to sniff out the BS. They're like, what do you mean remote work? Like, everybody's so, what is the word? Suspicious. Gosh, why?
Suspicious,
Holy cow. I was like, yeah, they're all so suspicious of it. They're like, what do you mean? Like, that's too good to be true. Can't be true. Sounds like bogus. But it's like, I'm living proof. Like, I've been doing it for 3.5 years. I have 20 coworkers that are all doing it as well, that are all nurses. So it's like, it's obviously a thing, and we see the jobs coming through. But I think the reason that a lot of people also get disheartened from it is because we see on the back end, these jobs only last 2 or 3 days and then they're gone. Like, they are super fast turnover. They're very desired. A lot of people want to get into them because a lot of people do want to get out. So having a platform like Go Beyond, it'll help you. You can set up like email alerts and like keyword alerts and stuff like that, to where it's like, hey, I'm a nurse and I have my Texas license and I have a background in OB or a background in NICU. And then we've seen jobs come through to where it's like, hey, you are a remote OBG, or not OBGYN, but a remote OB nurse that you're watching fetal heart tones for this hospital in Tennessee. And so you're just watching fetal heart tones for all of these different patients that are there. So then the nurses that are actually at the bedside, you're not taking anything away from them. You're actually supplementing them and allowing them to do what they need to do and not keep their eyes glued to a screen. They can keep doing what they need to do hands-on, and you're helping, supplement them. So really you're helping people in more than one way. You're helping out the patient in the background, and the patient's never going to know that you were even there, but you were helping them out because you were then taking things off of the nurse's plate that's at the bedside to then help them be able to, be better present.
I do have a question about that, because we have talked about AI a lot, and it sounds like, our fear is that AI is going to start taking over some of these jobs, like watching monitors, things like that. Do you see that at all in these remote positions, that could be a possibility?
100%. AI is going to be extremely disruptive to every possibility out there. But I was listening to a podcast not too long ago where it was talking a lot about AI, and it said the best thing about, or the biggest thing that will slow down AI and help people, continue in like doing what they're doing, and it will still require like a human touch, is lawyers. And I was like, what do you mean? That's odd. But it's like, these lawyers are going to be so hesitant to sign off to the bigwigs at the hospitals saying, hey, this AI program that's going to monitor fetal heart tones can take over this nurse's job and you don't need it anymore. And then one accident happens, that nurse sues that hospital, or that patient sues that hospital to hell and back. And then the lawyers, they're going to be like, no, we're not doing this. Is too risky. We still need somebody that has experience, that has eyes on this. It may just take less of them to be able to handle a larger workload because the AI helps pick up some of the slack. But I don't think that it's ever going to be to where it's like we're completely don't need people whatsoever.
Which is funny, because my understanding of AI and the people that I deal with in other capacities, the legal, environment are some of the heaviest developers of AI presently, trying to offload so much of their work and make it so much faster. So I agree. Our providers started using AI recently.
Oh, big time. Yeah. So there was something that I thought would be so nice whenever I was working, with my patients. So they're setting up these like little smart hubs inside the rooms to where I know I would have, there was the exam table sitting right there inside my little room whenever I would see a patient, whenever I was actually like in the clinic, not in the hospital. And basically, from my understanding of it, I was listening to a podcast about this. They were saying that this little pod, looks like an Amazon Alexa sitting there or something, listens to all of the conversation between the two of you. And then as you're doing your physical exam, like, oh yeah, normal sinus rhythm, lung sounds are clear, belly soft, non-tender, all this other stuff. And then it charts everything for you. It charts your HPI. It does everything. All you have to do is just skim through, make sure that everything looks good. And like, oh my gosh, that would have just saved me hours and hours. And I think that'll help a lot with burnout, actually, with providers.
Yeah, but what does a subpoena for the raw data that's kept in the server look like when something gets missed?
Yeah, very true.
Oh, just like it makes me nervous.
Yeah.
I did want to go back to, you were talking about your current job is based on productivity. So I have worked remote nursing jobs, and I left them partly because of also what you're talking about with your 55-year-old man. I helped walk my mom through going from a full-time night shift nursing job to retiring technically like 2 days before she passed away. So just a life of working full-time to being done. And my remote job was Monday through Friday, 9 to 5. That manager wanted you in your chair, in front of your screen the whole time. I mean, sending emails monitored. Like, it was just a very, it was a type of office environment that as a nurse, I was not ready for and honestly couldn't manage. I managed about 2 years of it and was like, I can't do this. So how do you feel that nurses that go from working 12s at the bedside and having so much autonomy do transferring into these other types of jobs, or are most of them like yours where they're just based on productivity?
Yeah, it's interesting because I did see both sides of it, because my first 2 years of working that very first job, absolutely loved it. Loved my boss, loved everything about it. Like, the situation was just perfect. I'd work 2.5, 3 hours a day, and then I was pretty much good for the day, answer emails, Teams messages, whatever. Tons of autonomy, zero micromanagement. Then our group got absorbed by another group, new manager, new leadership, new everything. And we went from 5 appeals a day productivity to 10 plus appeals a day was the productivity expectation. And they were up our rears the entire time. And I was like, I'm not doing this. My manager that I loved, she left, and like everybody, all of my coworkers started dropping like flies. And then luckily I already had this system built out of go beyond the bedside. And I was like, I need a new job. And so I think it was almost exactly a year ago now. I think I just had my 1-year eval not too long ago. And we were sitting in Sedona, Arizona. I was outside having a cigar and a glass of tequila with my laptop. And I was like, I hate this job. I'm going to find a new one. Let's put my money where my mouth is with Go Beyond. And I sat down. It took me 45 minutes. I applied to 7 different jobs, and I got interviews with 3 of those jobs, and I took one of them out of that. So 45 minutes, had a new career. It was, I called up my business partner, Alberto, afterwards. I was like, dude, it works. Like, holy crap, this is awesome. It works. So, yeah.
That's amazing. Okay. That's good to hear. Cause that is always, I mean, people that know me know that I did EHR management, loved it. But I was like, I can't. If there was a night shift job where I just did tickets and did build like at my leisure at night and met my productivity goals, 100% would do it. But to have the kids running around the house all day and wanting to be involved in stuff, and then you're like, sorry, I have to sit here and look at a screen that I don't let you look at because you're not allowed to have screens, is a little bit mind numbing. Okay. So your company is Go Beyond the Bedside, which is amazing. And we would encourage all of our nurses to go check it out. At least look at it, drive some traffic there, and know that you really do have options. And there are people that have gone before you and that have really, I don't know, it seems like you've hammered this out for us so that when we're ready to make that jump there, there's a way to do it. And with people that have tried it before and kind of worked out the kinks. So for that, we really thank you, Kelly. And we'll definitely put a link in the show notes for everybody that wants to get over there and check it out. And you will have a lot of traffic probably driven from our area of the country, hopefully, for that. I kind of want to move into, unless you have anything else, Kelly, do you want to go?
Well, you didn't answer my question. Is there somewhere that I can work remotely from Mexico?
Oh my God.
I don't know about international like that. That's something I've always flirted with, because I'm like, I probably need to ask my job, be like, hey, I have a mother that lives or a grandmother that lives in Vancouver that I want to go visit for a month. Like, am I allowed to do that? Because I mean, technically we link up with the company's VPN with our computer. So it's not even that I'm running off of the internet wherever I'm at. Like, it goes through that internet, connects to the VPN to make sure it's a secure connection and the server is good and whatever. And so it's I don't know why I couldn't, but I haven't gone with, I'm like, it's probably one of those things where it's a little bit too big to ask for forgiveness instead of permission. That should probably be one where I try to slide in like, yeah, my grandma lives up in Canada. Am I allowed to work in Canada? And then if I'm allowed to work in Canada, can I work in Italy? Like, yeah.
Right.
Yeah.
I feel like it's her 100-year birthday. Like,
exactly. I can't miss it. And I would hate to leave the team hanging. So I would want to keep working while I'm there, of course.
That's exactly right. I do think that if we could, I do have a question, maybe your thoughts on it, and Kelly, we can jump in. The idea of working with a team, I think, is very central to nursing. Definitely not something that you're taught in nursing school, but I think once you get your first job on a unit, you realize you make it or you don't based on the team that you work with. What's your view or experience with working with people that understand that, and maybe working with people that are okay with leaving the team hanging? I think we're walking through some stuff in our unit where maybe some decisions are being made that really prioritize personal, what would you say, like preference of schedules, and seem to lack a insight into the fact that one person not being at work means that another person has to be at work, or the whole team has to work short.
Yeah. And really that was something that I don't know. I don't know where it came from, but I hate being told what to do. So I'm kind of like a bad employee. So I hated like being on call whenever I was a nurse. Like, hey, if so-and-so isn't here, and then, or like they called in sick and they can call me in and I have to go in. I'm like, I want more control over my life. I don't want, my job dictating me. I want to have more control over what I'm doing. And this was something that Colton Lord and I talked about quite a bit on his podcast. Basically talking about like, there's a lot of people that nursing is their identity. And I think that's kind of like a dangerous thing. I don't think that you should have that, because you are an individual person. You have your family, you have your own life, you have everything else going on. And if your identity is I'm a nurse first and then I'm everything else second, like what happens if you can't do that job anymore? What happens if you decide that you want to leave that job and then you just have this, massive crisis or something? For me, I wanted to be somebody that was enjoying my life, traveling, getting to see things, spending tons of time. I mean, my wife and I basically haven't spent a day apart in the last like 3 years. And now we've got a baby on the way. So that's going to be really nice to be able to like, oh, I can watch the baby while you run down to the gym while I'm, doing my job, because I'm not having to be on the phone communicating with anybody or anything like that. I'm just doing my job sitting here at the office.
I love that for your marriage, but I don't want to spend 3 years straight with my husband. I'm just going to tell you that right now. I love him, but no.
No, maybe if you're traveling around enough, though, I mean, it's much easier to spend time whenever you're spending a month in Southern California hanging on the beach. It makes life easier.
Fair enough.
But yeah, that was really like the big thing, is like people need to untie their identity from being a nurse and not. I mean, it's obviously a serious thing. Take it seriously, because it's your career, it's other people's lives, all this other stuff. But don't take yourself so seriously about it, because it's like you don't like. What are you going to do? Get to the end of your career and be like, man, I'm so glad that I didn't try anything else, or I've put so much of my mental energy into this whenever I didn't really have to, like, I don't know but once again, I got into nursing because it was a safe, good career choice, not because I had a deep burning passion to do it. So maybe I'm different. I don't know.
Kelly, what say you to that?
I feel like I'm getting heart palpitations. You're telling me that my identity is not found in nursing, but it is. No, we have talked about this before, and I feel like that is a real danger that we do to ourselves, because I think we do take it like so personally and so seriously that the world is not going to keep turning if I leave nursing. Like, but then you take a vacation for 1 week and you realize everyone in the world is still being taken care of, and I am not the one doing it. So it does take like that kind of that step back to think of things a little differently. So I like.
Well, then nurses love to eat their own too. Like if somebody takes a vacation,
fans of that. Here
They certainly do, though. I mean, it's crazy because like whenever I had to give a 90-day notice because I was a provider, and I couldn't just give like a 2-week notice for my job. And that whole time, everybody gave me so much shit. They're like, "Oh, gonna go have a cushy job working at your home, huh? Oh, like not gonna be a real nurse anymore. I did all that to not be I'm like, have fun. Like, I'm going to go to the mountains. I'm going to go to the beach. Like, you guys can do whatever you want to do. Like that, I just don't have that much of a tie to my career. I don't know. I have much more of a connection with my own life than what I do my career.
I just feel like it's the most redeeming quality about me, quite honestly, is that like people get to know me and they're like, Sam, but she's a nurse, so she must be okay, I guess. So that's why I have to keep that in my back pocket or else it doesn't work. But you're absolutely right. And we've talked many times about nursing as an identity. And Kelly, I think we usually are more like joking about it and how we, what would we tell people when they ask us about ourselves? Like, I'm a wife, duh. I'm a mom, blah. But, I'm a nurse. Ask me questions about being a nurse because that's really fun.
Yeah.
And, other people don't care as much as we think they should.
100%. Well, and that was the funny thing. Alberto coming into this, like he never anything healthcare, nothing whatsoever. Had never even been to a hospital. I don't think he's an immigrant from Venezuela, lived in Miami his whole life. He's like, I don't think I've ever been to a hospital. I've never seen a doctor. So he was telling me, I was like, dude, like once I started looking at it from the outside and we were like, trying to figure out how to communicate with nurses in like marketing and stuff like that to try and like, drive people to our website because we want them, want to help them out and like trying to like dig into the psychology of them. I was like, dude, you're going to be blown away by this, especially whenever like we went to that camp with like 400 nurses. I like sat him down. I was like, bro, like this, you're going to have your mind blown. Like it's good. Like nurses are a whole different breed of people. I said it's almost culty. It's almost like, they have this shared trauma bond between everybody because everybody's been through so much shit together. Like, and you're going to hear some stories that are just going to blow your mind. Everybody's going to be cussing like crazy and everybody's going to get really drunk. And he was like, really? He was just like mind boggled. He's like, are you serious? I was like, dude, and then after the weekend was done, he's like, you weren't kidding.
I love that. Actually, we're going to have to do an episode on the cult of nursing.
Oh, that's a good one.
That is for real.
Yeah. You can't just be like a half nurse. You are, or you are not. Yeah.
Yep.
And it's the older nurses that are going to determine when you are in that cult.
Yeah. When you make it through.
Should, because just because you passed a test and got a job, I'm so sorry. Like, don't think that means that you can talk to me. It doesn't. Yeah. But a whole camp of I'm going to have to like do some Googling about this because I'm just like socially curious about what sort of experience that would be. And I'm not sure if I would want to do it or not. I don't know. I'm not sure.
It was really cool. I mean, I got to talk to this one, like one of those old gangster nurses that I think she was just getting ready to retire. She worked in the Navy her entire life as a nurse. Oh, wow. And she was like telling me about this story of she was hanging from a basket underneath a Black Hawk helicopter to go pick up some he was some special forces dude, Delta or Navy SEAL, something like that. And she was in, I think it was Iraq or Afghanistan, one or the other. She's in this basket. She goes down, throws this guy into the basket. They haul him away. She's doing stuff inside the Black Hawk helicopter before they got him to the base, had to, stitch him up, do all this other shit. I was like, that sounds gangster. But once again, don't really want to do it, but sounds really awesome.
I'm like, sign me up. I'll go now.
We work with a nurse she was in Iraq. Yeah, Kelly?
Yeah.
At one of the hospitals that they bring their traumas to. And her stories are crazy, but I'm with you, Kelly. I'm like, send me. I want to do it. Actually, don't even give me any tools. Just send me there with like a pair of gloves and like a knife. We'll figure it out. We can do this. Maybe a lighter. I don't know.
I was going to say you need fire though.
Yeah, I need fire, but that'd be fine. Otherwise, we could do it. I could be like a nurse in like World War I. I think that'd be so much fun.
Were you just chopping off limbs right and left?
Yeah. Here's your morphine. Let's go.
Yeah, bite down on this stick.
Yeah. Oh. Yeah. Okay. Well, I really appreciate you walking through not only your story, but also the way that you're trying to help nurses. I think while it is a cult and while we do eat our young and we are sort of snobby and some of us are drunk, there's a culture within a culture of trying to care for each other and making sure that we need all of us to succeed because one bad nurse, with one of us gets bad publicity, it looks bad on all of us. So we appreciate what you're doing for us and getting out there and getting the word out. We are going to, if you're willing, move into our little pulse check section and see how that goes. Kelly, do you have stuff to start? Don't ask me the question from last time, please, that you omitted. I don't want to answer that question.
Right. Well, okay. So I have this question and it goes along with what we're talking about. So Sam, first, what does your perfect retirement look like?
Okay, I've been thinking about this. Philip has this dream that we're going to retire at 55, which is 100% not financially possible. I'm just going to tell you that right now as the person that goes to work all of the time. I'm torn. I want to really travel like David's talking about, but I feel like I will want to be around my grandchildren. So maybe ideally I will stumble into $1 billion and I will travel the world with my grandchildren, but not my children and their spouses. Just my grandchildren.
You've already given up on your daughters-in-law before they're even
praying really hard for good daughter-in-laws. Like I'm going to be the best mother-in-law. There's no doubt about that. Like I'm going to rock it, but I hope that they're, lovely. And maybe that they don't have moms and they need me. Like, I feel like that might be what I need.
Like your sons have to marry orphans.
You said it, not me. But yeah,
Well, David, I feel like you're probably already living your best retirement life, but do you have plans?
That was the goal. I mean, so I started working remotely before my dad retired, and I was, we were just like hanging out and then the nice thing about whenever we were out west was that I was still working East Coast time. So it was 8 to 4:30 Eastern time. I'd have to wake up really early. Whenever we were out on the West Coast, I'd have to wake up like 4:45, start my day at 5, but then it'd take me 2.5 hours, 3 hours, whatever it was to get done with my stuff. That's like 8 in the morning. And then we would have the rest of the day to do anything that we wanted to do. And I'd be off work at 1:30 in the afternoon. So we just had all the free time to go to the beach, go hang out. We spent a year in Sedona, Arizona, absolutely loved it, did a ton of hiking and just really enjoyed all of it. I mean, and so basically retirement is kind of like what we're doing right now, and just getting to enjoy traveling around. But I think we kind of got it dialed down a little bit more. We're like, okay, we love New England. Well, that's probably going to be where we move to after this is New Hampshire. Love New Hampshire so much. And it's right on the coast and you're an hour away from Boston. So major airport. We love Europe. So we'll be able to zip over to Europe anytime we want, direct flights, and then spend about like April through December 31st in New England, get a little taste of some snow and whatever else. And then January 1st, we always take a trip out. Our friends are moving to Portugal. And so we'll dip out, go hang out in Portugal for a little bit with our friends out there, and then head to Florida for a few months, get out of the New England winter. And that's the beauty of working remotely is you have location freedom. You can be wherever you want to be. So anytime that the weather's not bad, we can snowbird it down to Florida, spend a few months down there, and then come back whenever the weather's nice in New England. So that's retirement for us.
Blech. I'm sorry, but you're you're really making me not like my life right now. Like you're really selling your lifestyle, because I'm like, that sounds really nice.
I was going to say, Kelly, can you like proofread my resume? Because I have a website to get on when we're done recording here.
We do resume strategy sessions as well.
Okay. I bet you do. No, my husband really is going to retire at 55. He gets a pension at 55. And so our youngest of 4 will be graduating that same year. So God willing, he will be able to live independently. And then our goal is for me to travel nurse and my husband just to like be an Uber driver wherever we go, because he could do that.
Problem with travel nursing, though, is you're still tied to a location. You
know.
still have to spend 3 months in the middle of nowhere, Nebraska, because that's where the good money is. Instead, you have a consistent paycheck. Great. I mean, my benefits are incredible. I get 8 weeks of paid paternity leave for my job. My wife's doing all the work having the baby, but I get 8 weeks paid off for whenever our kiddo comes along. And insurance is incredible because I was working for an insurance company, but now I'm working for like a consulting company that still works with the insurance companies. So incredible benefits. And instead of, having to spend 16 weeks somewhere, or 13 weeks for a travel assignment, you get to spend 13 weeks anywhere you want to spend it.
Yeah. I'm telling you, you're making it sound good. I believe you.
Well, I was going to ask about birth order. So you had mentioned that you have 2, it sounds like older brothers, potentially.
Yep, 2 older brothers and an older sister. I'm the youngest.
Okay. So you're the baby. Kelly and I are both different in our family.
I'm the baby.
Yeah. No. So do you hold true to the birth order stereotypes, or do you buck the trend in some way?
what are the stereotypes when what are they? Are they that the youngest is like the best and they're the most handsome and obviously the smartest?
That's
And
The favorite. Yeah.
answer
I mean,
that question.
yeah. I mean, we are the best in every single way and everybody loves us. We're number one.
Yeah, I think,
well, honestly, though,
true. Yeah.
Honestly, though, I do attribute me being an entrepreneur and like my disdain for authority 100% comes from my older brothers because they love to boss me around. They love to tell me what to do. They love to tell me what I could do and what I couldn't do. And I'm pretty sure that like got burned into my brain at a young age because now I'm a pretty much a terrible employee. I don't like being told what to do. So me being able to do what I want to do and them telling me, hey, here's the job that we want you to do, go do it. And I just crank it out. Like that's what I need to have.
It's no wonder ER was your place. I feel like all ER nurses are terrible employees. Like I was with some hospital executives earlier this week and they were talking about dumb charts that I don't care about. And they're like, it's just really, we just really struggle changing the culture of, our employees. Yes, sir, because I'm worried about getting the 24 gauge and this crashing little kid while you want me to color in green, red, or yellow, this little part of a chart. And I just don't care. And I will never care. Mm-hmm. And I'm so sorry.
Nope, 100%.
But I must be a horrible employee, as you say. But, you sound like a baby being the oldest and having a baby brother and now being the mother to a baby boy of 3. I'm like, oh my gosh, you guys are exactly what I thought you were all of these years, just ruining everything and everything's easy for you and nobody holds you accountable. And my life's harder than everyone else's life. So I think I also, keep to the birth order.
My wife, she's middle child. So she's like, she tells me all the time, she's like, I've got the typical like middle child stuff. And she's like, you've got the typical youngest boy stuff, like you just like, oh yeah, everything will work out. Why wouldn't it work out? Of
That's
course
exactly right. Kelly, I don't know. Do you think that you're a true baby? I feel like you might be.
I am, except for I am like the caretaker of the family. I feel like my older sister, I've always kind of been in charge of everything just because of circumstances. But I think my personality is very much, I'm going to do whatever I want and I'm going to get away with it. And that's just how it is.
Oh my God. That 100%. Just drives me batty. I get away with nothing in life. Sorry. Do you have we kind of sprung this on you. If you have a question that you'd like to throw in, you're welcome to, David, or we can keep going. We usually do 2 or 3.
I guess this would be good just for like the business itself. Like we're trying to figure out how, like, what is it about nurses that they say that they're interested in the job. They say they want to work remotely, but then whenever it finally gets to the point where it's like, you need to apply for it, everybody chickens out. Like, what do you think the thought process is behind that? Is just safety at the bedside? They're afraid of losing skills. What do you think?
I feel like for me personally, I think a lot about changing jobs, but when it actually comes to it and I walk into my unit and I see my people, even if my job is so stressful and I've had it, there's this like pull to like stay in that trauma bond. Like it's better to be in the stress that than like go into the world you don't know.
Sure. Yeah, makes sense.
I'm not. I might be trauma bonded, but I'll drop y'all like a hot potato. Sorry. No. I actually really love working bedside. So that's my main problem is, like I said, I've been able to do remote, but I've always had a bedside job of some kind because I actually really, really enjoy it. But you alluded to it earlier when you said that nurses are skeptical of things that are too good to be true. And I think that serves us well as a profession. Like we are always right. Like everything is always too good to be true. We don't trust our patients for anything, not in like a bad way, but we don't trust, how would you say, like we do an assessment, we do our own assessment. We double check our meds. We just don't trust the world because we're trying to accomplish something. And I think that that's good and it's driven into us. And so I think my guess would be that that's how a lot of nurses are. They're like, this sounds like it's going to be great, but there has to be something on the back end. There has to be something else. And I don't know what it is yet. So I'm just not going to move. So,
yeah. I told Alberto the same thing. I said, I can see why, like I'm part of that world. I understand it. I lived it. And it's like, they are super averse to any risk because any risk involves, oh shit, something really bad could happen, with this situation. So I said, I think that's kind of our biggest hurdle right now. So that's the reason why I want to come talk to people like you, so that I can get the word out and explain to people, I promise it's real. It's here. I'm doing it. Come follow me on Instagram. I'll show you.
You're also asking me to never poke someone again.
Oh,
I mean, you still can.
And that's really hard to do.
Kelly and I pass a IV crown sort of theoretically back and forth between the two of us of who got the harder stick. So I think currently we have to share it because we had to trade patients. We both missed twice this last weekend and had to ask the other one to do it, which we were both successful. My gauge was bigger. My patient was bigger.
Was a baby. So
a very little baby. That's fair. But
this is something I don't understand about the ER. Why? Because we were just talking at a family party last week, and this is completely off topic. Why is it that a random dentist office can use nitrous on a kid to calm them down? Why in the heck aren't we using that in the hospital instead of wrapping up a little kid and holding them down with 4 people to get an IV put in them? Why don't we just give them a tiny bit of gas, make them a little loopy, throw the IV in, they wake up 5 minutes later? I've never understood that.
Well, I actually am trained to nitrous, and it is ridiculous the amount of training that you have to have in the hospital to give nitrous. It's so stupid because literally you turn it on,
cowboy dentist office. They're just here, you want some gas? Sure. Yeah. It's crazy.
No, I agree. It's very silly.
I would argue the other side of that I don't know why dentist office have any sort of anesthesia and sedative at all. The airway in a dentist office stresses me out to no end. I don't understand why we don't have more people that come in that have something stuck in their upper airway from a dentist office, because it seems very unmanaged, and I don't even like talking about it. I'm just
they're just super sedated, laying flat with blood pooling in the back of their throat,
Yeah.
It's I don't know. Although we did have an anesthesiologist a couple weeks ago. We didn't want to start an IV on a kid who had a coin just right above his epiglottis. And he's even if it falls over, you can just stick your fingers back there and pull it out. It's real high. And I was I don't think that. No.
Yeah. Why don't we hold him by his ankles and shake him and it'll fall out?
That's exactly what he said. After that, I was I'm not going to do. He's you just turn him over. I was how about you just start the IV in the OR? How about that? But anyway, Kelly, do you have one more, or are you?
I do. I have one more. And David, this will be good since you are just going to have your first child. So if you could choose, for you, Sam, one child that could be famous for something, what would it be?
Kelly, why do you do this to me? Okay. I think that my youngest child would easily be famous for something. He's very much a baby. He's very lovable. He's very adorable and personable and bright. I don't think he could handle it well. I feel something horrible might happen to his personality or his morality if he became a superstar, and that would stress me out very much. So I think I'm going to go with my middleest child that doesn't necessarily like to be looked at. So I would make him famous for something. My oldest, I also am concerned that it would go awry. So I'm going to say the middleest.
Okay, but what would he be famous for?
Oh, was that not the question? Okay, sorry. You had me very concerned about their adult lives there. Art, he would be art or music. He's a little music note floating around. Yeah.
Yeah. Fiddler, a famous fiddler.
He's my fiddler. Yeah.
I honestly have no idea, because we're little girl in there. She's only half baked, so we don't know what her personality is going to be like. So Yay. I don't know. But if I had to choose, I honestly would not want them to be famous at all. Yeah, I think that life seems miserable. I would much rather be wealthy without the fame versus being wealthy and famous. I would much rather just have the money and nobody knows who I am. And if I couldn't go to a nice restaurant without somebody shoving a camera in my face, I would lose my mind.
See, I think I would be an investor, like a talent.
I think I would choose for them a famous occupation, like an astronaut, right? They're famous, but it's for achievement, or an Olympian, but an Olympian curler, or Something
I really missed the mark
ridiculous.
on this question.
Or like what was the latest thing? Oh, break dancing is now in the Olympics. Like if I could say that my son was an Olympian break dancer, wasn't
it going viral? It was like the lady from, it was like New Zealand or somewhere weird like that. It was horrible. And we're like, what are we doing here?
See, you could be famous. She could be my daughter. And I could be like,
we can agree that that's not a sport though, right?
I can't do it. If I can't do it, it's a sport.
If I tried to do that, if I did it for 60 seconds, I would be dripping sweat. So I mean, it's gotta be something.
We don't have time for this conversation. It's not a sport. Kelly, the number of things that you can't do that are not sports.
Yeah. The number of things that I can do that could be sports. That's another
IVs
thing. Yeah. I'm an Olympian.
IV Olympics. Imagine the power of 100 million people watching you throw that IV in.
All right. Now that you could start for Go Beyond the Bedside.
If that was at this nurse camp, that would be, Kelly, could we do like a skills relay? Like how fast can you drop the NG and get the Foley in and put in? We could call it drunk girl relay.
What if you went in a circle and you had to do it to your person, like the person to your right, and then them with their NG and Foley and IV had to then do all of that to the person to their right?
A Foley catheter. I don't want to put a Foley catheter in.
First person has to have a rectal tube and run around with it, you know?
Oh, if I'm drunk, you can do anything.
Yeah, except get shoes on you. Has been my experience.
You don't know.
Well, David, thank you so much. And thanks for hanging with us at the end. So again, Go Beyond the Bedside, a great opportunity for any nurses that are interested in looking for something different, but then also, like we talked about, ready to make the jump and maybe look at life a little differently, which is always awesome. So
I was gonna say, we have something for you guys. Like if anybody shoots us a DM, we have a 5-step process that we have. It's basically giving you a 5-step breakdown of exactly how you can find your next remote job. And it's got a bunch of our resources in there that we provide, but also it's just kind of like a framework for it. And so, it's helping people understand. And we were saying, you don't need us if you don't want us, but we're giving away a 5-step process for it. So if anybody shoots us a DM, it's at Go Beyond the Bedside, all one word. Just send us a DM and we can send it over to you.
Oh, sweet. Awesome. Thank you. Okay. Yep. So again, we are at the Nurses Station with Kelly and Sam. Thanks so much for hanging with us. We'll be back next week and we'll save you a seat.
Bye.
Hey guys, this is Kelly from At the Nurses Station. Sam and I would like to remind you that the views and opinions expressed on this podcast are strictly our own and do not in any way reflect the position of our employers. This podcast is for entertainment purposes only and in no way should be considered medical advice. As always, consult a qualified medical provider for questions regarding your health or medical conditions. We hope you had fun listening to us today, and we'll see you next time at the Nurses Station.